Protect your cognitive vitality by learning how to avoid risks. These days, it seems like almost everyone is wearing earphones. People wear them on the subway, while walking outside, and even as they fall asleep. But could all this listening do more than just hurt our hearing? The research says that if the volume is loud enough to harm our hearing, it may also increase the chance of problems with memory and thinking. The Lancet Commission found that hearing loss is one of the top things we can change to lower the risk of dementia. The risk is related to the degree of hearing loss, so by starting early, we can reduce our risk by preventing further damage. Hearing loss is very common as people get older. In the United States, about 1 in 3 people between the ages of 65 and 74 have hearing loss. For those over 75, it is nearly half. But hearing damage often starts much earlier. Studies have found that parts of the brain related to hearing can start to change in young adults long before they notice any hearing problems. The damage to our ears from loud sounds leads to the loss of auditory input to the brain. Without this input, the cells in the brain that process sound can die off. The brain is very adaptable and can make up for lost cells at first, so we don't realize that our hearing has been damaged. But as the damage builds up over time, the brain can no longer keep up. This means that by the time we start noticing changes to our hearing, a significant amount of damage has already taken place. Hearing loss can also affect dementia risk by making it harder to talk and connect with others. When it is hard to follow conversations, some people withdraw from activities they used to enjoy, leading to social isolation or depression, which are also linked to dementia risk. So how can we protect our hearing and our brains? First, turn down the volume. Sounds under 70 decibels are considered safe. For louder sounds, how long you listen matters. For example, exposure to sounds around 85 decibels, such as occurs in heavy traffic, for over 8 hours can hurt your hearing. Just a few minutes of exposure to sounds over 110 decibels, like a loud concert or power tool, can also cause damage, so make sure to wear earplugs to dampen the sound. For reference, a normal conversation is around 60 decibels, a vacuum cleaner is about 70 decibels, and a motorcycle is around 90 decibels. Our earphones may also be putting us at risk for hearing damage, as many connected devices reach volumes up to 110 decibels. The 60-60 method is considered a safe rule of thumb. It involves limiting exposure to 60% of the maximum volume for no more than 60 minutes at a time. Also, constant background noise like traffic, construction, or loud machines makes the brain work harder. This extra work can cause stress and may lead to memory and thinking problems over time. Many people with hearing loss turn the volume up louder and louder, which can make the problem worse. A better option is to use a hearing assistive device. Clinical studies indicate that hearing aids can help lower the risk of memory problems in people with hearing loss when they are properly calibrated and are used regularly. If you find yourself always turning up the volume, it is a good idea to see a doctor. They can help decide if hearing aids or other devices might help you. The earlier you start, the better. Taking care of your hearing now can protect your brain for the future. To learn more about hearing loss and brain health, visit cognitivevitality.org.